All right, so I'll get started. I'm Joaquín Beltrán. This is an advocacy training for endcoronavirus.org. So we want to do a training to empower more people across the United States to be able to take action, make a difference, meet with their policymakers if they're interested in that, and show you the process of doing so and how we at endcoronavirus.org can help you be effective at that. So, so this is me. My background is in politics, public affairs, advocacy. I've worked in issues of higher education, economic development, and local politics, as well as federal campaigns. So I'll give you an overview of what we'll be covering today. So change, right? There's a lot of different ways we can create change. So we'll touch on all the different ways that we can do that. The stakeholders involved in creating change, advocacy versus lobbying, how to get meetings, how to get these legislative meetings. Once we're in the meetings, what are the goals? Also, how to win COVID-19. So this is some of the priorities that endcoronavirus.org has put together that we can share at these meetings. Also the roles, right? Who's at these meetings? What's the role of every person involved? What's the process as well to have an effective meeting? Some of the do's and don'ts, some of the potential outcomes, they could vary greatly. Continuity and learning process, right? Having these meetings is just the first step. We want to have strong working relationships with these policymakers in order to actually affect change and bringing what we learn at these meetings back to the organization so that we have continuity. And finally, take action, right? So after all this, what can we do? So, all right. Cool. So change, right? So, all right. So legislative meetings, having meetings with policymakers, advocacy, this is just one part of change, right? There's a lot of different ways that change can happen. Obviously, we've seen through history, civil disobedience is another way change is affected and can be very effective at creating change. So, right, so rallies, marches, protests, coalition building is another strong area. In endcoronavirus.org, we've been working on that process for the last couple of months, doing some great work in Virginia and starting to do it in Arizona as well. And it's bringing a coalition together and reaching consensus with that coalition to actually create change that's really effective as well. Obviously, technology, we're experiencing it right now. Technology creates vast amounts of change. Education, helping people, understand different areas and changing mindsets is another way we affect change. Public relations. This is an area, obviously, if you're on Twitter, you've seen how public relations works and the different campaigns and how that moves different people as well. And obviously lobbying too, when people go to visit legislators and sometimes contribute money to their campaigns. And so all these, there's a bunch of different ways to create change, but we're gonna focus on advocacy today. So stakeholders. Right, so the legislative process. So in every state or every municipality, you have you have the policymakers, right? And so, for example, in a state like California, we have our own legislative branch, right? And you could think of this analogous to Congress on the federal level, right? So in California, we have state Senate and we have the state assembly, right? And so typically, someone introduces a bill in one part, and they have to confirm the bill in the other branch, And if they agree, they'll send it up to the governor, and the governor ends up either signing it into law or vetoing it. Now, as part of this process, there was a lot of interest groups, and so this is good, but it comes with challenges, right? So this is good because this is the foundation of our country, right? People are making their voices heard, and some are more organized than others, right? And so part of this creates a challenge where, how do you make your voice heard, right? If you're not part of one of these interest groups, or if you're not part of a movement, or if you want to affect change in your local community, how do you get started with that? And we'll discuss that in more detail later on. Internal politics, right? There's other things to keep in mind. So if you look at cable news, you'll often see, it's Republicans versus Democrats, right? But there's internal politics that happens, right? And this is just relationships, right? Do people like each other? Do people work well with each other? Is there some history that creates some type of friction that prevents people actually working together, right? So those are things to keep in mind and to navigate as well if you want to be successful in this process. And there's also external politics, right? So for example, the governor has certain supporters and other legislators have other supporters, and sometimes they can't come to an agreement because the bill or the topic or the issue doesn't align with both of the supporters of these elected representatives, right? So there's the navigating of the external politics to keep in mind as well. So we'll just touch on this briefly. Advocacy versus lobbying. So endcoronavirus.org is part of nexi.edu, which is a 501c3. And so what's cool is that as a 501c3, we're allowed to advocate, right? But there's a limit on that, and that's 20% of the budget, right? And so how you do this is you make sure you don't spend more than 20% of the budget for that. And you also, you work on education, right? So part of the process of advocating is just educating policymakers on why certain policies would be favorable, right? Would be helpful for the community, for different stakeholders, right? And so at endcoronavirus.org, we work a lot on that type of education. Now, there's other organizations who decide to create a dedicated arm to lobbying, right? And so they would create a 501c4, and then you can use all the proceeds of that towards things like lobbying, right? So that's the difference on that. So now, how to get meetings, right? So there's different ways. Some of them are, easier than others. Existing relationships, right? Do you have a personal connection with someone? Maybe you're trying to get a hold of the governor, but you don't know the governor. But maybe you know someone on the school board, right? Or you know someone on the city council. These are existing relationships you have, and those are important meetings that can lead to change as well. And also, they can provide you a connection, maybe to the mayor, maybe to the governor's office, right? So leveraging those existing relationships to get these meetings is a very effective way. If that's not possible, the website has several channels. Usually it's a form, sometimes it's an email. And it's most effective if you are from that community, if you are from that state. Legislators don't typically want to take meetings with people that are not their constituents, right? So that's why it's important that we empower as many people who live in their communities to take action locally. And you can call in as well. Sometimes they'll just direct you to the website if you call in. Sometimes you can have a conversation and ask them who's the appropriate person for you to reach out to. And then also, if they don't respond from a previous email or from a submission from a previous form, just follow up, keep calling. you know, this is like anything, you know, if someone doesn't respond, you just keep trying. All right, so we have the meetings, right? So what are the goals in the meeting, right? So it's important to be focused on our outcomes. So first and foremost, we learn what's going on, right? So there's certain things that we hear on the news, or we see in the newspaper, or we see on social media, and that gives us certain information. But not everything is public, right? So when we go into those meetings, we understand more of the details involved, right? And so we spend a lot of time motivated by understanding, right? Ask them about their decision-making process. You know, what are some initiatives? How are those initiatives going? You know, any challenges that they have, right? And this helps us better understand how to navigate this process in order to help them help the community, right? So now another goal is a partnership, right? We want to be able to gain interest from these policymakers. So, you know, if it's the governor's office or, you know, or LA County, you know, and so in that process, we show them some of our priorities that are part of how to win, right? And by learning first and understanding what's going on, we are able to see which of these priorities that we've been working on really applies to the situation here, right? So instead of going in and saying, hey, like these are all the things that should happen, well, some of those things may already be going on, right? So it might be better to just understand the situation and then see which priorities can really help them and help your community and work on those specifically. And the final thing is to have a follow-up meeting, right? So have the logistics for scheduling, information, plans. So as long as you cover these three things, that's a highly effective meeting. So now in the process, right? So we have, you know, first thing, whoever is in the meeting, you'll have intros. You'll share your background, location, you know, if you're a volunteer with endcoronavirus.org. And then you'll share what's going on in their state, right? Or they'll share what's going on in their state, right? It's their state or their city or, you know, whatever the focus area is. And ask clarifying questions. This is a great opportunity for that, right? To just dig a little deeper and maybe understand the nuances. And then from there, we share the work we've been doing at endcoronavirus.org and find the common areas of collaboration, right? And this is where the partnership opportunity is. And then you plan the next meeting. So how to win, right? So we have a document outlining 9 of our priorities. You know, some of the really important priorities right now that we're sharing are the Safe Family Program to make sure that, you know, if someone is sick in the family, that they're quarantined from the rest of the family. You know, as we were hearing from the discussion with Yanir and Asim earlier, you know, the families are a super spreader type of environment. You know, since we are a research organization as well, a new thing we've added, and Yanir mentioned in the town hall earlier today, is the CT scans and how effective they are at helping people, you know, get results quickly. You know, they're also safer for the healthcare workers as well, right? So that's something we're sharing. And obviously travel restrictions, right? Having smart travel guidelines to make sure that if someone's a carrier, that they're not transmitting it to other geographies. Okay, so in the meeting, right? So it's important to identify what are the roles. So, you know, typically Yanir joins us in the meetings and he speaks on the technical aspect, the studies and some of the policies. And then we'll have the constituent, right? Which is you. And you'll share a story, right? You'll share what's going well. You'll share challenges in the community, right? You'll bridge the gap, right? And the constituency gap. And then you'll have the elected representative or staffer. So, you know, often, you know, when we talk about these things, it's like, oh, we're meeting with the governor or we're meeting with the mayor. But oftentimes you end up meeting with the staffer. And that's actually good. That's how the process goes, you know, especially during this time. You know, time is very limited, and during a crisis, these policymakers are having a lot of people reach out to them, right? But what happens here is that when you speak with the staffer, the staffer then conveys this information to the mayor, to the governor, and is influential in getting these different policies passed. So, you know, if you meet with the staffer, don't get discouraged. That's actually a really good sign. Okay, so some of the do's and don'ts. So ask clarifying question, right? Again, motivated by understanding. Let's learn a lot during these meetings in order to reach an outcome where we can help our communities, right? Let them know you can follow up on information you don't have available, right? So if you don't know something, you know, don't tell them something that may not be true, right? This is an opportunity to establish a strong relationship, right? So if you don't have certain information, it's okay to say, we don't have that right now, but let me follow up with you and I'll get that to you as soon as possible. Lean on others on the call, you know, for their expertise or you know, questions. And so now the don'ts, don't promise what you can deliver, right? Again, we're forming a strong working relationship with policymakers. Don't make up information, and don't engage in partisanship, right? So this meeting is to help create safer communities during this pandemic. And so it's not a partisan issue. It's just about smart guidelines. So now potential outcomes, right? So what can happen from these meetings? Absolutely nothing, right? That's a potential outcome. And you know, sometimes that happens. But what also can happen is that they're interested in what we're saying. You know, they're interested in learning more. They may be interested in working with endcoronavirus.org. You know, maybe they want to implement one of the plans or policies that we've developed. You know, and what can happen and what often happens is they refer us to someone else, you know, in the administration, legislative body. You know, we had someone from the community colleges, the head of the community colleges, refer us to the mayor, right? So that's a really good thing, you know, and utopia can happen, right? We end the pandemic and we have a successful outcome. So anything's possible. So now, how do we keep this process going, right? So the worst thing that could happen is you start the process and then it just, you know, feathers out, nothing happens. So continuity is important, and learning through this process and sharing these learnings is important as well, right? So when we have these meetings, we bring them back to the group, we share what we learned, and we put it in our in a Google Sheet in order to make sure that anyone can see it later on and follow up on it if they need to. Share what went well, share what didn't. You know, this is helpful in, you know, maybe sharing these ideas with other communities or other meetings so that they're more effective. Follow up right away with any plans that happened in the meeting, right? So if you said you were going to provide information or that you were going to introduce someone else to the conversation, do that right away. You know, and constituents are the main point of contact. So this is all about the constituents, right? So, you know, potentially if the constituent, you know, can't maintain this these meetings anymore or this relationship anymore, they should find someone or ask, you know, for help in finding somebody to hand off that role to. Cool. So now let's take action, right? So how do we take action? Go to endcoronavirus.org. and sign up for the newsletter. We have a bunch of amazing information on there, on states, even internationally. You can find our guidelines there. We've also made it so if you just want to call your elected representatives, we made it very easy. So you go to gospeakupamerica.com/end coronavirus. You'll plug in your phone number, you'll plug in your address, and whether it's governor, Congress, you'll receive a phone call and you'll receive a text message with a script. And the phone call is connected to that policymaker's office. So you can directly make your voice heard. And we're doing a lot of work on Slack, right? So please join our Slack and get involved. And if you want help in organizing meetings with your local representatives, we can help you with that too. So that's it. Let's crush COVID-19. And I'm happy to take any questions.
Don't all shout at once.
So we have a question in the chat, which is, let's share a couple of our examples of success.
So, it's a very early problem, right? So some examples of our success is that we've been able to have meetings with, the head of local community colleges, and now we're in the process of having a meeting with mayors in order to help them create smart guidelines to help protect more people during this pandemic. Additionally, there's been a lot of coalition building in Virginia, which has been really amazing. And we've had a lot of calls across the United States to their policymakers. And so part of the process here, and South Carolina as well, we've been having meetings with different stakeholders there, with the businesses, with the local representatives as well. And this is all part of the process of helping them transition towards smarter guidelines to protect the people in their community. And so, but part of this process is that the United States is very big, right? It's very big. So part of this process is to empower you, right? To empower more people to have the tools to effectively speak with their elected representatives in order to affect change, give them the tools to do coalition building. So that's part of the reason we are doing this training. And then if you look in the comments, Kyle just shared a link of the mayor of Tenek. Is that how you pronounce that? Speaking with Yanir as well. And so we have a great resource and leader in Yanir who is able to speak effectively on these things and really help policymakers make better decisions for their communities.
Ask a question. Does anyone want to ask a question? Raise your hand or put a chat in the chat box and we'll unmute you. Okay, Toby, go ahead.
Oh, I'm unmuted. Okay. Great. Are you able to share any recommendations for advocating within a large apartment building? And then I'm also wondering if you're able to share any of the needs that you're hearing from the decision makers.
Yeah. So the apartment building, well, so that's not part of this training, but just offhand, it's I don't know. I don't know if you could share the issue in the apartment building. Are you able to share the issue in the apartment building? Oh, Toby,
Okay, you can hear me? Yeah, the issue is there's a common entryway and a lot of people are coming in without masks. So plenty of residents are wearing them, but we have a lot of delivery people and residents and there's sort of a small space in the entryway. And maybe it's not a big deal. Maybe the exposure time is so low, it doesn't matter, but.
yeah. Yeah, well, that's a great question. It'd be good to speak with you after about that. Maybe we could speak with Yanir about that as well. I think so. Part of the work we're doing here is, not just on the macro policy, but also on the community level, right? Because that's where it really matters, right? And it's in some places they've had a very successful top-down approach. In the United States, it's a bottom-up approach, right? And it has to come both ways, right? So the issue you bring up is really important. I'm happy to go into more details with that, but just in short, it's just communicating with your neighbors in the apartment, seeing if they also see this as a problem. If they don't, maybe you share information why it could be a problem, and then you bring them together and you share that with the management at the apartment building. Would be one first process, I think. But yeah, let's talk more about that. And your second question was some of the needs of policymakers?
Yeah, from the decision makers that you might be connecting with, or there's some common themes that are.
Yeah, I think some common themes that just have come up is just trying to manage, keeping people healthy and trying to manage businesses opening, right? Or different, organizations opening, right? This pandemic, disrupts all the plans that they had, right? And, including budget shortfalls, right? Budget shortfalls are another issue that keeps coming up. So just thought, off the top of my head from what we've, and some of the discussions we've had, those are some things that come up.
We have another question here from Rick. Rick, go ahead.
Hi there, can you hear me?
Yes. Hey,
All
Rick.
right, thanks for taking my message.
Yeah.
I kept trying to unmute, it wouldn't let me. Question for you here. I'm a known quantity at the local county level. Big fish, small pond. Do you have any tips or suggestions for how I can leverage status at the lower level to work that up to state level? Obvious things would be, try to get the local politicians to do an introduction to somebody at a higher level. That's the obvious one, but any other tricks of the trade that you can think of?
Can you give me a little bit more details? Are you able to share where you're from and
I'm in the Upper Peninsula of Michigan.
Okay. And you're involved in the county, you're saying?
Yeah, small area, small town area, so everybody knows me. I'm one of the prominent business people in the area.
Yeah.
So I'm just thinking down the road here, if I find the time, trying to advocate for, in the coronavirus, and I might be looking at doing some advocating for some folks doing SME volunteering in the local area, and contact tracing, etc.
Yeah, well, that's fantastic. So since you're one goal is to create a green zone, right? I don't know if you're familiar with green zones, but by increasing testing, by doing great contact tracing, you can start to have an area that is clear of COVID-19, right? And that would be a great example, and you would be a success story, right? And a model. So, you know, additionally, if you're trying to, I guess part of your question is the challenge of how do you get notice from decision makers who may be, you know, higher up a level, right?
Mhm.
So part of that is, so you know, if leveraging existing relationships isn't effective, you know, sometimes it's campaigns, right? It's campaigns that kind of force, you know, these elected officials at a higher level to pay attention because they have no choice, right? So, you know, one way you could do that, you know, we've set that up with the phone calls, right? Is you could, you know, organize a campaign to target, you know, that elected official's office, or you know, elected officials, you know, maybe in the state senate or wherever you're thinking, and you know, show them that their constituents really want, you know, this change to happen, right? That they want green zones, right? That they want to implement some of the policies that we've developed to help make these communities safer. And then you can leverage that in order to have a meeting to create tangible deliverables, right? Or sometimes they'll just act on their own, right? After these kinds of things. So that's one way to do it. We'd love to speak with you after this too, in order to see if we could create some type of specific plan in order to help you do that as well. So yeah, would love to help.
The green zone concept is something I just heard about and learned a little bit about last night here, and I'm brand new to the End Coronavirus Now program. Particularly interested in learning more about it because in our particular area, we've pretty much been spared COVID-19 thus far. So
that's amazing. Well, let's keep it that way, right?
Yeah.
Thank goodness. I can't see you here on.
Yeah, it wouldn't let me turn the video on.
Okay. All right. And your name again is
Rick Lewis.
Rick Lewis. Okay. Yeah. Please find us on the Slack. Send me a message and let's follow up on this.
There, it turned on finally.
Okay. There you go. Okay. Great. Okay. Well, great to meet you, Rick.
Nice to meet you too.
And thank you for your question, and thanks for everything you're doing.
So how do we follow up?
Could we include an invite to the Slack in the chat, or Katie, what would you?
Yeah, we're on it.
Okay, cool. Yeah, so they'll connect you, Rick. Thank you so much.
Thank you.
Yeah. Yeah, we have about 10 more minutes. If anyone wants to, looks like we have an FB question.
So there's a Facebook question. Let's say I have a green zone. How open is activity inside the zone?
I think that depends on your community. Different communities have different guidelines for how open is activity inside the zone. I think, you know, whether you're in a green zone or you're not, I think the, you know, the protocols for safety are the same, right? Because you want to maintain a green zone. So we have protocols on our website that we can direct you to in order to help maintain a green zone. Katie, are you able to help, or Angela, with that person who asked the FB question with that?
Yes.
Okay, great, thank you. Yeah, it's a great question.
There was a question about, somebody just typed in that Maryland, how do we think Maryland is doing? And Gio responded that Maryland is struggling. It's one of the worst states. Ruth, I give you an opportunity to speak if you feel comfortable. I will unmute you.
Oh, wow. Someone just,
Oh, I just asked because our governor has been praised so for being Republican, but still having stricter guidelines.
Okay, Sandy, you can go up next.
Oh.
But Ruth, go ahead.
Oh, I just asked because our governor has been praised for being Republican, but having stricter guidelines than some other states.
yeah, you're right. And I'm sorry, I think I may have missed your question, Ruth.
I just asked how you thought Maryland was doing.
Oh, okay. Yeah, you know, just from what I've seen, I think the governor there is, you know, focused on the right thing. He's trying to, you know, bring down the number of cases. I think he actually bought some test kits from South Korea. You know,
Right.
so you know, he's going above and beyond. It looks like he needs more support from the federal level as well. You know, but if there, are you from Maryland yourself?
Oh, yes, but I'm wondering how accurate are his test kits? How would I find that out?
You know, that's a great question. I don't think we have that information right now. And I think that's a question, you know, we keep asking, right? You know, Yanira was, you know, mentioning the PCR test, and those have a 30%, you know, false negative, right?
Right.
So, yeah, that's why we're pushing the CT scans, right? So if we could actually push the CT scans in Maryland, that would make a huge difference, right? So, you know, if you're interested in working more in Maryland, and you know, we can use the resources we have at endcoronavirus.org in order to, you know, help you and help the rest of the people in Maryland. Yeah, would love to follow up after this with you.
Okay, I'm just collecting information right now, but
Sure.
I signed up for, I signed up.
You signed up. Okay, fantastic. Okay, and we can send you an invite to the Slack as well if you'd like to join us there, or we
I
could do
already
it.
did.
Okay, fantastic. Great, great question, Ruth. Thank you.
I don't know if we have any more questions.
Okay.
But
Yeah.
a little bit of disruption here.
Yeah, I know. We got Zoom is could be a disruptive place. I guess there's people who just decide to put random stuff on there. Not very helpful. Yeah, well, that's okay. Anyways, we're focused on the good things, so there's always going to be distractions. Cool. Yeah, we'll take a couple more minutes just to see if anyone comes up with any last-minute questions. Yeah, and you know, if you haven't, please follow endcoronavirus.org on Facebook and on Twitter. You know, sign up for the newsletter so we can keep you up to date as much as possible. Looks like Zoom support has a question.
I am inquiring what their question is.
Oh, okay. Okay, great.
Hi. There's someone asking about green zones and returning to normal. And I think
Yeah.
I asked earlier, maybe I can help out a little bit.
Yeah, go for it.
I think the point is that once you're in a green zone, there is a process of going back to normal. And ideally, one is back to normal fairly quickly. The point of a green zone is that there isn't any internal transmission. So the disease is dead. And that gives an opportunity to get back to normal. So as long as you protect from other people coming in, anybody who wants to come back home, they have to go through a 14-day quarantine, which is the standard way that places do this. Then you can really go back to normal. Now you want to do it in stages because just as you get to being green, then you still worry that maybe there's something that you haven't seen, so you have to be a little bit careful. But really the process is one of restoring activity to normal. And it can, you know, be quicker or take a little bit slower depending upon how much testing one has in order to know what the situation is at that time. Does that help?
Yeah, that's great.
We have a question from Renee Centeno.
Hey, hello.
Hi.
Hi, yeah, I'm actually not in the United States and I'm not an American. I've been following whatever Yanir and Nassim have been, and Joe have been saying about this since January, and I live in Honduras. My country is in a tough spot, I think. And I was wondering if you have any ideas on how, or if you've worked with maybe other countries and some suggestions on how to do, I don't know if to call it advocacy
Yeah.
or revolution. I don't know. I don't know if it's exactly what we need, but yeah, thanks.
I have a friend who's an environmental activist, I believe, in Honduras,
Yeah.
and he commented on a lot of the corruption that goes on there, and the struggle with that. I will follow up with him and speak more about this.
Who is he? Maybe I know him. It's a small country.
Yeah. Well, we met once on a panel where we spoke together, so I'd have to follow up with him there. I'm forgetting his name. Yeah,
Okay.
but maybe Yanir has some insight on international advocacy.
That'd be awesome. Thank you.
Yeah. Yanir looks like he's muted.
Oh. 1 second. There you go.
Okay. So the advocacy globally is not all that different. I mean, every place has its own properties, right? Every place locally here, but also internationally. We do work internationally in many different countries. And the point is just that building a coalition. So if you can find other people who want to work with you on making things better, that's the way we enable things to happen. So
yeah, I actually have been in contact with other people, and especially doctors are really getting worked up about the whole thing, and they're actually doing some things. But I wish I had like more influence, I guess,
Right.
to be to like I've shared endcoronavirus.org everywhere I can, and some of them actually follow you, but I don't know how to make it more clear.
So the way to do is Joaquin can set up, and we can set up a shared call, a Zoom call with the people that are there, and we can discuss strategies together, and we can share our experience in other places. And we're really happy to work with you to improve the situation.
Okay, that would be awesome. Thank you.
So just connect with Katie and Joaquin, and they will set it up.
Thank you. I'll look for them in the Slack. I'm there.
Great. Thank you, Renee.
Thank you.
Okay.
Okay.
I've got to go.
All right. Well, I think we're wrapping up too. So did we have anything else, Katie, or?
No, that's all.
Okay, cool. All right. Well, thank you so much to everyone who attended and participated, and for all your questions. Thank you, Yanir, for adding your important insights to help answer the questions. Like Yanir said, please be safe, please take care of each other, and please join us at endcoronavirus.org in order to make all the difference that we can during this time. Happy Memorial Day.